Ojiro is unavailable to join us today. So I'm going to go ahead and get the meeting started.
This conference will now be recorded.
So calling the meeting to order at 9:01 a.m. And first on the agenda is introductions. I'm Nancy Wise, Benton County Commissioner and Chair of the Board of Commissioners. Pat?
Good morning, Pat Malone, Benton County Commissioner and Vice Chair.
Good morning, Joe Kirby, Benton County Administrator.
Vance Cronin
Jeff
County.
Van Arsdal. Go ahead, Vance.
Already did it. Vance Cronin County Council.
Jeff Van Arsdal, Benton County Sheriff.
Joe Hahn, Equity, Diversity, and Inclusion Coordinator, he, they pronouns.
Erica Milo, Board Recorder.
Suzanne Hoffman, Health Department Director.
April Holland, Public Health Director.
Good morning, everyone. Rick Krager, Chief Financial Officer.
All right, good morning, everyone, and thank you for joining us. Next is announcements, and I think we have one announcement from Sheriff Van Arsdal.
Thank you, Commissioner. This last week, we participated in a dodgeball tournament over in Albany, sponsored by Lynn County. The beneficiary was a charity softball. Philius Place was the beneficiary. I'm sad to report that this office came in third out of 6 teams that participated. Lynn County District Attorney's Office had a team, Lynn County Search and Rescue, Lynn County Sheriff's Office, Albany Police Department, my office, and the Corvallis Police Department. And Corvallis and Albany Police Department played for the championship, and Albany Police Department beat Corvallis by 1 person. And so APD was crowned the champion. And if you get a chance to go on to social media, Chief Harnden, Albany Police Department, posted a pretty impressive victory video on their page, and it's still an opportunity for everybody to donate if they wish to the charity as well. So it was a great time had by all. Commissioner Wise was there. It was pretty fun. So we'll try and expand it, make it a little larger next year. Of course, Lynn County is now 0 for 3 in competitive ventures. So they're trying to come up with the next charity so they can get a win. So we'll hold out till softball season on this end. So thank you, Commissioner.
Thank you, Sheriff. It was a fun time, and my kids had a ball. And I have to just say my 9-year-old was super impressed that Chief Harnden actually played and that she's a chief and a woman. So that was like a really great moment for us. So thank you. All right, so moving on, we have review and approve agenda. I do have a couple additions to the agenda. Under other, I would like to add a conversation about the commissioners potentially supporting HB 4123 and signing on 2 letters of support. And then I also just had a quick question for the commissioners regarding the NACO conference in a couple weeks. So I'll add those under other. Any other changes? All right, I will consider that approved. Let's go ahead and move on to our work session. Update from Department Operations Center is our first item with Suzanne Hoffman and April Holland from the Health Department. Welcome.
Good morning. Today is April's 2nd day back after being away for 2 weeks, but I have no doubt that she's already got a wealth of information to share with you all as the update. So I'm going to turn it over to her, and I will only jump in if necessary.
Good morning, Commissioners, Joe, and everyone. It's nice to see you again. I am glad to be back in the saddle after 2 weeks away. COVID remained quite active over the last couple of weeks, and our cases and overall community transmission continue to be very high. But we've seen a reduction in the number of weekly cases. Infections are expected now to be peaking statewide are starting to reach that peak, but some areas will see further increases before reaching that height. Of course, when we reach the top, it's a long way down to the bottom, so it's going to take some time. We will get there, though. Total reported cases for the entirety of last week was 1,159, which is a 25% decrease from the previous week. We may still see some ups and downs here, and this is still a pretty staggering number, but we will keep a very close eye on the data and hope to see continuing decreases. Our testing positivity was 17.6 last week, 17.6% positive last week. It's been between 15 and 18-ish% for the last 4 weeks. And despite being a very high figure, it's among the lowest in the state. So that just shows that we do continue to have testing capacity and are able to, at least given the number of cases that we're seeing, maintain a testing infrastructure. As you all know, our CD team, our communicable disease team, has moved to a focus on outbreaks in the priority settings. They're very, very busy, as many high priority settings such as long-term care facilities, schools, and other settings continue to experience disruptive outbreaks. OHA's COVID hotline and website has been in use for a couple of weeks now. It's been a great resource to point the general public to answer their questions on what they should do, how they should inform their contacts, and there's also a survey that they can take so that we can continue to get data from people on their potential exposures, so that some data is continuing to be collected. And we need that data. And it's also, primarily it's a way to connect people with services, which is incredibly important. In terms of hospitalizations statewide are almost as high as they were with the Delta wave. Not yet sure if we're going to surpass that peak as previously indicated, but there are plenty of people hospitalized. We don't want it to go up anymore. About 1,100 people currently hospitalized with COVID in the state. In the past week, there have been about 20 people hospitalized with COVID on a given day at Good Samaritan Regional Medical Center. And very, very sadly, we've reached the point in this wave of Omicron where, as you know, hospitalizations and deaths are lagging indicators. So first we saw the spike in cases, we started to see the hospitalizations rise, and we have learned of several deaths. Just in the past full week of data, 7 people lost their lives due to COVID in Benton County. Moving on to our schools, a lot of our schools are working so hard to quilt together on a day-to-day basis, in many cases, the educational and other needs of students. We've got superintendents and principals subbing. We've got people working in custodial, bus driving, doing so many more and different jobs than they are accustomed to, and schools continue to be impacted. We've had some local schools experience short-term closures, but haven't had it be as widespread as it could have been, thanks to largely to really high vaccination rates, to universal masking, and to just it being a safe space for children to receive their education. I want to talk about tests for a moment. I mentioned before that our local testing capacity in terms of our laboratories is hanging in there. The Samaritan did move to an appointment only for its previous drive-through site to avoid congestion, and then Willamette Valley Toxicology expanded the Benton County Fairgrounds testing that they had tentatively scheduled through the 29th of January. It'll go through the 11th of February, and it's co-housed now on the fairgrounds with the FEMA vaccination event that's happening. So there's one entrance that points to testing and one that points to vaccination. So you go there and get your COVID needs met. The 12 million home test kits from iHealth continue to come into Oregon. Those serving populations at high risk and with barriers to access, including CBOs, service providers for unhoused community members, and more, have now received a survey from OHA to request tests. We at the Public Health did receive some tests for distribution for some who have immediate need, but service organizations should receive their allocation soon, and then we'll be better able to fill in those gaps. Again, any tests we receive at the local level will be used to provide rapid testing to people at highest risks and those experiencing barriers to access. And obviously with the less than 10,000 tests that we'll be receiving, we're not going to have the capacity to send tests to households. However, while I was out in the last 2 weeks, something pretty amazing happened with the federal program to get tests delivered directly to people's homes. It's 4 tests per household, and we may see an expansion of that, but that program is still active, and 4 tests per household is an improvement on 0 tests per household. So we are grateful for that. The website to request tests is easily available if you Google USPS COVID tests, and many have started to arrive. We got ours a few days ago in the mail, and we encourage everyone to take advantage of that. And we'll keep you informed if that is expanded. In terms of vaccination, all of our partners in the community continue to work very hard to get vaccination out to all who want it. We do have some community and school vaccination clinics this week. We started on Sunday with the Boys and Girls Club, yesterday in Philomath. We will be in Alsea today. We will be at the Alsea Library. And then we have 2 more events later on this week. We also have FEMA in town, as I mentioned before. They started a few days ago on the 31st, or yesterday on the 31st, and they'll be here through February 11th at the fairgrounds, 11 a.m. to 6 p.m. every day. So some other just fun stats for us. Our primary series vaccination rate is up to 72% for all residents getting that primary series done. That's pretty great. About 46% of Benton County residents have received a booster. That's compared to about 41% statewide. And 56% of our 5 to 11s have received at least 1 dose of vaccine. The national figure is 30%. So Benton County really comes out and is getting their young kids vaccinated. I just have 2 more pieces of news in vaccination. Yesterday, Moderna's COVID-19 vaccine received full FDA approval. So it's no longer under an emergency use authorization. It's been provided to millions of people with a very good safety profile and is quite effective. It comes with a very perhaps fashion-forward, definitely COVID-crushing name. It's called SpikeVax now, so we can all say SpikeVax more often, I guess, in our daily vocabularies, or at least I can. And then finally, the dramatic saga of vaccine for little ones, 6 months to 4 years, continues. Parents of young children continue to hold their breath, including me, as Pfizer announced yesterday that they may seek FDA approval for a regimen for those youth while data is compiled. It would be a 2-dose regimen that would get EUA approval while a third dose trial is being conducted is quite unusual. So if that application is accepted, data analysis will take a couple weeks. So it's possible that we could have emergency use authorization for our little ones by late February, or maybe not. We'll continue to follow and keep you updated. And I'm happy to answer any questions you may have to the best of my ability. Thanks.
Thank you, April. Questions for April? Commissioner Malone?
Yeah, I'll start you off with an easy one here, April, because you're just getting back. So you said 72% of Benton County residents are fully vaccinated. Does that mean if Benton County had 100,000 people, which is pretty close to what we have, that 72,000 would be vaccinated? Am I understanding that correctly?
Yeah, it's actually 67,657 commissioners. So really, really, really close. And that's the primary series. Yeah.
Okay. Let's see. I guess get a little harder here. So we may have peaked as far as infections, different areas, but we're either peaked or just past or just before. Any sense of what the trend would be as we come down from the peak? We went up sharply. Is there, I know the East Coast is a couple weeks ahead of us, and the United Kingdom and South Africa were even further ahead. Is there something in other people's actual numbers to kind of give us some guidance what our trend might be coming down from the peak?
Thanks for that question, Commissioner. I think, we're all looking really closely at that data around the country and beyond. And we're certainly hoping for a swift trajectory downward. But, as I mentioned earlier, even on the way down, those numbers are really high, and it's really hard for people to maintain focus when they see the arrow pointing down. It may be human nature to kind of shake things loose a little bit and to feel like, oh, one lunch out or one visit to the bar or whatever might be okay, because those numbers are still very high. So it's really up to us in many ways, how well we do on the way down. So keeping those masks on and hanging in there until we really get down to that place where the cases are at a lower level, we have low community transmission, we'll be able to, with more confidence, have conversations about what COVID looks like, and how we can, at least for the meantime, start to relax a bit. But it's not time yet, and it won't be time when we're halfway down the mountain.
Okay, so at least through February, we need to continue to be vigilant, and then you can tell us at the end of the month or beginning of March that happy days are here again. We're so ready for that, April. But it is one of the metrics, the positivity rate. You mentioned 17% currently, and I remember the state metrics of 5%. If you were above 5%, you were not doing that well. But it's good to know we're doing relatively well. But is that a key number to kind of guide us to know what our current situation is?
Yeah, Commissioner, it's all relative, isn't it? I mean, if we went back a few months and looked at some of our case numbers, we would love to be in that position now, as alarming as those may have been at that time. Yeah, so there are a couple different metrics that that we continue to look at. We certainly look at hospitalizations. We look at case numbers and outbreaks too, because as well as the positivity rate. When we do make a shift, a large shift to COVID looking more endemic, an endemic, it starts with end, but it doesn't mean anything ends. Endemic just means that there is an underlying presence of some acceptable level of disease in the community. Think something like tuberculosis has been endemic for quite a long time. It still causes a lot of death and a lot of illness in many parts of the world. And so in an endemic situation, you can have epidemics where you have spikes in cases. And so we may be in a situation where, yes, we have an overall low level, but we in a time of a spike, people might just be recommended or required to put their masks on for a while and to power through it. We're not sure exactly what that's going to look like, but I think what one thing that is essential as we move forward is that we learn from the lessons of the earlier pandemic, and that we look out to what's happening in other areas of the world. And so I'm really glad to see more attention be placed on, looking at individual countries and trends elsewhere in terms of anything new that may be coming. I'm not sure if they answered your question, but there's a lot to consider as we move forward. And I really do hope that in March, I say everyone go out and have a picnic together, because it's a beautiful spring day and COVID is very low. And that day will come, and hopefully sooner than later.
Looking forward to that, and it's reassuring to have you back on the job, and hope you got a good break out of this marathon that we're in.
Thanks, it was great.
And April, I do have one quick question for you. Could you just repeat the percentage of people who are boosted in Benton County? You said it was 40 something.
Yeah, I think it's 46.2%.
Okay,
yeah.
Thank you.
You bet.
All right, any further comments or questions, Suzanne or April? All right, thank you so much for joining us today. And that brings us to our next agenda item, which is the update on the Justice System Improvement Program with Nick Kurth, our Jsip Program Manager. Welcome, Nick.
Hi, everybody. Good morning. I'll wait for Commissioner Malone to get back with us here. And I'm going to need screen sharing, please, Erica, or whomever is providing it this morning. Thank you. So I'm going to start by sharing the Jsip program timeline that I shared with you a couple of weeks ago. And I'm going to start off by saying that we've reached a point where it can no longer be business as usual. There's a lot of red on this timeline, and the red indicates that we're behind schedule. And there are implications of that, which I will talk through you. And so you're gonna keep hearing me say we can't proceed as business as usual anymore. We did thankfully make some really important decisions. I won't belabor those, but of course the most important was agreement on pursuing the north site next to Hewlett-Packard, and we actually did that per our timeline, so that came in on time. Lumen LOI, we kind of hope to have that wrapped up in January, but we have an LOI back to them. Gary Pond is in contact with their broker. No real impacts from that slipping into February, but certainly we want to get that wrapped up. New courthouse funding agreement. Rick Krager and I are sitting down with David Moon and Phil Lemon here in the next week or two. We're just working on dates. We had originally planned to get that going in January, so it is behind schedule, but no significant impacts. Moving into February, there's a lot of things that are happening. So first of all, I missed one up above. Marketing Strategist RFP, that has been issued. I'm doing the information session on Friday. 2 weeks from now, we'll be doing interviews. So that's really important because we're not making any progress relative to communications resources, whether the position for Jsip or our PIO. And frankly, there's no point in bringing on a market strategist if we don't have communications resources. We won't have anybody to do the work, or we have to change the RFP. So that's something I'll be talking with Joe about here when we sit down later this week. But that's one of the things that is going to have to be looked at from through a different lens, and can't do business as usual anymore. Decision on crisis center construction has not been made yet. Frankly, a month and a half ago, we outlined a timeline that had our crisis, outlined a timeline to Representative Rayfield that had our crisis center opening in April of 2023. What a fantastic thing that would have been going into the bond measure. There's no chance of that happening. We will be lucky if we're breaking ground a year from now. And so you can still look at that as a positive. It is, of course, but it's a lost opportunity relative to passing the bond measure. And so again, business as usual is not going to get us to the finish line. I'm issuing the construction manager RFP next week. Vance is reviewing that, so it'll be on the street next week. That's mostly on time, but moving very quickly. I worked hard this past week to get that done. And so we need to get it on the street because that individual, that firm will help us get the design RFP issued. We do still need to work out the scope of construction for the construction manager RFP, and I'll be talking with Joe about that as well later this week. In March, we will hopefully have a marketing strategist on board. I do have several companies that are attending the information session that if we can get them on board by late March, we will essentially be a month late. We have to have a communications coordinator hired and up to speed by that point. I had hoped to have that milestone already crossed now, or at least hired. That was originally a February 1 deliverable. The implications of having the marketing strategist come on board late by about a month is that we will be polling in late April and early May. And then that impacts our second round of public engagement effectively. We can, of course, do our second round of a public engagement whenever we want, but initially we had wanted to proceed it with polling, gather some much needed data about how people were feeling in the community. If we stick to that plan, it's going to push public engagement number 2 into kind of where we were last summer. In June, July, it's going to be summertime. So we'll have to look at that and decide, what we want to do with it. But we will not have polling results until late May at best, if we can stick to this timeline. The rest of it, pretty straightforward, but I do want to highlight that a year from now, and I mean literally a year from now, we are done. We are filing our papers. We're going into safe harbor. We have done all that we can. And so again, that's a very finite timeline, which I want everybody to keep in mind. And really, we need to share that message more broadly. across the organization. So let me stop there. I have another slide I want to share with you, but let me stop there and answer any questions relative to where we are and what's coming.
Any questions for Nick? Commissioner Malone?
Not a question, but I share your sense of urgency, and I think, speaking of communication, we need to get the word around to at least staff and kind of key community members. Here's the timetable. We're not ahead at this point. At best, we're where we need to be, and in some of the pieces we're had some slippage. So just how to communicate that sense of urgency, I think, is really important at this point.
Agreed. All right, I want to put up another slide, if I may. This was one that came to my mind the day after commissioners decided on the north site. and it's not meant to alarm you. It's not meant to look at the glass half empty, but it is a very pragmatic look at kind of what we face. Excuse me, that's the crisis center timeline. Okay, so this is relative to the bond measure. And as I said, I thought of this the day after we, 2 Fridays ago, when we agreed on the north site. And relative to this coming bond measure, it has way more significance than any of the previous ones that we've failed. We will own an expensive north site, possibly acquired through legal means. The new courthouse will be on the north site, which is a good thing, but it means we can't sell that north site anymore and get out from under it. The DA will remain in the historic courthouse unless Rick Krager can come up with $16 million, and based on discussions he and I have had, that money isn't available. So DA will be in the historic courthouse, half a mile away from the new courthouse. I can imagine how he's going to feel about that. More importantly, we're going to still have our aging jail downtown, which is really, a critical piece of Jsip. So not only will we be transporting adults in custody to Norcor and Lynn, but now we'll be transferring back and forth to the north site, so further impacting our operational costs. Additionally, we will be financially leveraged. We will have spent the $20 million that we're comfortable borrowing on the new courthouse, which means we're not going to be able to borrow our way out of this solution. And as Commissioner Weiss knows, having just attended the taxing jurisdiction with me, there's a whole slew of new levies and bonds in line behind us. We're not going to be able to turn around and go back to the voters. We may not ever be able to turn around and go back to the voters. And in fact, when I shared this slide with Rick, his reaction was, yeah, we probably are going to have to start a capital savings plan. And as I do the math, that could be $5 to $10 million a year over 10 to 20 years to make up for Jsip's, for a failed bond measure. And finally, we will have spent millions on the assessment and pre-design, and all of that isn't leverageable. Some is, but much of it is not. So again, I can't underscore enough that this is not business as usual anymore. And we're going to have to make some tough choices to be really, it's not enough to just do a good job. We got to be doing a great job, or we're going to be, in a really tough situation if the bond measure fails. So just wanted to underscore that. And this is a slide I really would like to share with all the leadership team. And in fact, where the impact comes to the organization as a whole is if we are forced into a situation where we have to have a capital savings plan of the magnitude that would be required. that's going to hit every budget. We're not going to just turn to BCSO and say it's your problem. It's going to hit every budget. This is real for all of us. And with that, I'm going to stop sharing my screen. Happy to answer any other questions.
Nick, on your slide, you said AIC is transported to Lynn County. Did you mean Polk County?
I did. Thank
Okay.
you for the correction. I will update that.
Any questions or comments for Nick? Commissioner Malone?
Yeah, I've said it before, and it fits in with your last slide, Nick, is we can't afford to lose.
Right.
It's all on the line. There's a lot of pieces, and maybe that's good news that we have, I guess, a year to get people's attention. And like I said at the taxing district meeting, this isn't just a Benton County government project, and the rest of you can sit back and watch. Well, good luck. We're behind you. We need active support of the sheriff's office and the DA and community leaders, and I guess that's our job in near and medium term, is to convey the message of we're all in this together, and we need a united front to move forward. And we have a great product to sell, and I guess that's our job, to get the word out and make sure that we have good communities support, and from the people that are closely involved, and then kind of like a target, you move out into the outer rings and get regular people supporting this project. But I absolutely agree with no more business as usual. This is just from April Holland's presentation. Maybe we can get COVID down to a dull roar so that we can change focus and have this be front and center almost no matter what the topic is. Maybe like a good politician, you're talking about the library, and then say, oh, by the way, what kind of support do we have from you on Jsip? So appreciate the sense of urgency, Nick.
You're welcome.
And I'll just piggyback on there a little bit. Thank you, Nick, for delivering those sobering thoughts. And I hear the words, we can't afford to lose, we can't afford to get it wrong, which is absolutely true. But I think the way I would like to think about it is, we can't afford to try to proceed with what the community doesn't support. So, this is this is for the community, approved by the community. So we really need to make sure that we are messaging clearly to them and getting all the public feedback necessary. I think how we are moving forward is based off of data-driven best practices. I feel confident that our foundation is good. So that's positive. I just think it's a matter of making sure that we are getting the message out there, educating the public, and really listening to what the public is going to want to support and their feedback, which I'm committed to doing.
Well, you're absolutely right. It's all about execution, and that's what I'm sharing with you as well. You're absolutely right. We do want to be data driven. We do want to listen to the public, and we do want take the necessary steps to be able to do that coming over the next, I'm going to say 6 to 9 months. So sorry, my message was a little blunt this morning. It reminds me of a line from one of my favorite movies. Do you want it sugar coated or straight between the eyes? I maybe should have led by asking you that question. This was more straight between the eyes, but appreciate the time this morning.
Thank you, Nick. I'm a pretty blunt person myself, so I appreciate it. All right, any other comments or thoughts for us, Nick, or any other questions or thoughts for Nick? Commissioner Malone?
Yeah, back to the communication piece, and I know you're stressing that, and I completely support getting our communication capability back up to where it was, and then have some additional capacity. So looking forward to some good news on that front.
Thank you, Commissioner Malone. And I see we have someone from the audience. Normally, I don't think we take comments during this, but I realized I skipped over comments from the public. My apologies. So Sarah Wynn, I would like to give you 3 minutes to say something that you would like to say. If you have any questions, we may get back to you via email or phone call. Go ahead.
Okay, sorry, can everyone hear me? Yeah, sorry for my not understanding how these meetings work, and I'm not sure if this is the appropriate forum, but I do have some questions about the JSIP. Specifically, I am kind of confused about how the schedule works. The JSIP funding rests on having a bond measure, and it kind of sounds like the county budget will be in trouble if the bond measure doesn't pass. But that depends on, public support. My question is, since I haven't been following this project for the years it's been going on, what was the process like to determine the level of community support that this bond measure would eventually have? When did the research on community support happen, and what did it look like? I guess that's my main question at this point.
Joe?
Commissioner, I think it would be best if Sarah had a one-on-one conversation with Nick to get her questions answered. I think it would be appropriate for Sarah to share any concerns that she would like with the board today. But as it relates to question and answer, I think Sarah would get a lot more out of a one-on-one conversation with Nick to make sure she has the total background, and we don't have the ability to cover that in 3 minutes or less.
Perfect. Nick, would you like to put your email address in the chat so that she can send you an email and contact you? Thank you, Sarah. Did you have any further comments, or was just your question?
If Mr. Chris wants to make himself available for me to ask questions, that would be great.
Perfect. Thank you, Sarah.
Awesome.
All right. Any other, anything else we need to discuss on this agenda item? Seeing none. So I would like to quickly go back in time to the comments from the public and see if there is anybody else from the public who would like to share their comments. Anybody else from the public who would like to share a comment? All right, hearing none, we will move on. And that will bring us to our business meeting. And we will start with the consent calendar. Do I hear a motion to approve the consent calendar?
I will make the motion, but first I'd like to thank these folks and the other people that that volunteer for our various advisory committees, and they are critical part of county government. So thank you for stepping up. And with that, I'll move to approve item number 5, the consent calendar.
Second, all those in favor say aye. Aye.
Aye.
Motion carries. And that brings us to the next item, which is a proclamation. The matter of proclaiming February 2022 as Black History Month and Black Futures Month in Benton County. And joining us today, we have Johan, our Equity, Diversity, and Inclusion Coordinator. Welcome, Johan.
Welcome. Good morning, everyone. Can I have screen share access, please? Thank you. All right, I want to make sure we had this visually available as well to make it more accessible for everyone. All right, so I'll be reading the Proclamation for Black History and Black Futures Month. This February, we celebrate and honor the history of Black and African Americans through Black History Month. This year's theme, Black Health and Wellness, centers the experiences of Black people in the United States and their history of experiencing racial, medical bias, and discrimination. We reflect on the past to create a more bright future. Continuing our recognition from last year, we're recognizing February as Black History Month and Black Futures Month. The Association of the Study of African American Life and History, ASALH, was founded in 1915 by Dr. Carter G. Woodson. In February 1926, the first Negro History Week was celebrated and set in February to include the birthdays of Abraham Lincoln and Frederick Douglass, 2 key figures in the history of African Americans. In 1976, the week expanded to Black History Month, also known as African American History Month. ASALH recognizes this year's theme of Black health and wellness with the following. This theme acknowledges the legacy of not only Black scholars and medical practitioners in Western medicine, but also other ways of knowing, such as birth workers, doulas, midwives, neuropaths, herbalists, etc., throughout the African diaspora. The 2022 theme considers activities, rituals, and initiatives that Black communities have done to be well. Community clinics and Black-led medical and nursing schools, such as Morehouse School of Medicine, are examples of Black health and wellness. ASALH recognizes grassroots organizations and mutual aid societies, such as the African Union Society, National Association of Colored Women, and the Black Panther Party, which provides or provided spaces for Black people to counter the economic and health disparities and discrimination that are found in mainstream institutions. Black mental and emotional health are also critical, and we celebrate the Black practitioners and patients throughout the county and in Oregon who offer and seek holistic health experiences. Benton County and Oregon have a history we must not forget. While Oregon was founded with a ban on slavery, our Constitution also forbade free Blacks from living in Oregon. The Oregon Territory and the state had Black exclusion laws that made it difficult or impossible for free Black families to settle in Oregon. This created systems of inequity that still have reverberations today. Redlining, homelessness, and environmental racism are just a few examples of many issues Black Oregonians face due to Oregon's history, our history, of discrimination and prejudice. While the Black exclusion laws have ended, we cannot move forward without acknowledging our past and addressing our present. Black health and wellness continues to be harmed by medical racism, such as assuming Black people have higher pain thresholds or care providers not believing symptoms that Black people experience. Black Oregonians define the racist history of our state and stand for equity, community, health, and wellness. One such Oregonian is Gertrude Trudy Woods Rice. Trudy was one of the first Black women to become a registered nurse in 1968 after graduating from Portland Community College here in the state of Oregon. She faced racial issues throughout her life, from living in the now destroyed city of Vanport and moving out a few months before it flooded, to experiencing staff that did not believe she would graduate because she was a single Black mother of 5. She was assumed to be the housekeeper and faced other racial microaggressions and stereotypes. Despite not believing in her, Trudy got her degree. She faced racism throughout her career, such as patients walking past her station demanding to see head nurse Trudy, only to be surprised that she was that Trudy. Trudy held a variety of jobs throughout her career, including working for the Department of Health as surveyor, where she interacted with people who rarely, if ever, saw people of color. In another job, she helped institute diversity training after her coworkers made a racist birthday cake with a picture of Aunt Jemima and the text, "Happy Birthday, Mammy," a term used to undermine and insult Black women. Trudy's fight for equity, diversity, and inclusion throughout her career is a reminder that we have continuous work to do. Trudy has been recognized for her impact by the Oregon Historical Society, and we join them in celebrating her and other Black people that have impacted the health and wellness of all Oregonians. Benton County is committed to improving the experiences of Black community members and their health and wellness. County initiatives such as the Health in All Actions and Patient Inclusion Committees are working to identify and address health disparities that Black community members and other members of historically oppressed or marginalized identities experience. As a society, we have a long way to go to address the historical legacy of medical discrimination. We are committed to partnering with community organizations and training our county staff on equitable and culturally competent practices. Black History and Black Futures Month work together to honor the achievements, strife, and challenges of Black Americans in the past, while looking forward towards equity, diversity, inclusion, and justice. Black Futures Month celebrates art, culture, and science that brings us all toward collective, beloved community. Benton County's 2040 initiative fits the vision of Black Futures Month by encouraging us all to work towards thriving and vibrant communities. Therefore, be it hereby proclaimed that February 2022 is Black History Month and Black Futures Month in Benton County, and all residents and community members are encouraged to join in this observance.
Thank you, Johan. And do we move the proclamation, Vance, or are we just saying thank you and moving along? I got lost in my packet.
That is entirely up to you. If you'd like to read it, you can. If you don't, you don't have to. We've gone back and forth over the years on that.
Okay, well, since I lost my place, I'll just say that sounds good. Thank you so much, Johan, for reading that. Really appreciate that. Any comments or questions from you, Commissioner Malone?
Well, I would have been glad to move the proclamation. The first proclamation of 2022 is proclaiming Black History, February's Black History Month. But
no, go ahead and do it. That's good. If you're ready, please do.
Well, I think I just did, but
All
so
right.
I would. Okay.
All those in favor say aye. Aye.
Aye. And thank you, Johan.
Motion carries.
Thank you. And also happy Lunar New Year.
Thank you. All right, sorry for awkwardly wading through that, but hey, we got through it. Let's see, next we have with old business, discussion and decision approving an amendment to the Small Business and Micro Enterprise Grant, extending the date and eligible use. And I see that Rick Krager, our Chief Financial Officer, has joined us. Welcome, Rick.
Good morning, commissioners. Good to see you all. Happy to say I am safely back in the States now after my adventures in Mexico. So, you know, I've learned a lot of lessons learned in this new COVID world and in traveling afar. So I'm sure Mr. Kirby also has lots of stories he could tell from his last journey. So again, happy to be here with you today. Purpose of today's request is to extend a current contract that we have with Business Oregon for community development block grant funds. Just as a little bit of history for this, this is a grant that you all approved approximately a year ago. It was dollars that were allocated due to the COVID-19 pandemic as emergency dollars for the community development block grant, specifically targeting low and moderate income businesses and micro enterprises to really help in terms of recovering from the pandemic. Specifically, these dollars were given to Benton County for non-entitlement areas, and we had a 12-month period to be able to use those dollars. What has happened since then, and I should also say, this is also pass-through dollars that we partner with community lending. here in Benton County to be able to administer these dollars. We met back in late fall with community development and community lending, excuse me. And basically what we had understood is that they had made good success in using the dollars, however, had not used the entire allocation of $150,000. And I should also just note, I think in the write-up, I incorrectly said $250,000 on this agreement is actually $150,000. But basically, they had made good strides, but had not used all of the dollars. The way the rules are written with Community Development Block Grant with these dollars, if after 12 months, we have not spent, we have the option to be able to extend to April 1st and also be able to open the dollars up to entitlement areas of Benton County. The recommendation was to be able to create a broader opportunity for these dollars, still with a priority to the non-entitlement areas. However, obviously, we all want to be able to use the money here in Benton County and get these dollars expended. So the purpose of this is Business Oregon has approved and has submitted to us a contract amendment that would, once again, entitle us to use the money all the way till April 1st of 2022 and amend the language to open it up to the entitlement areas of Benton County. I do want to apologize, commissioners, that I intended trying to anticipate your questions to find out a little bit more specifics on exactly what the dollar amount that has been used at this point. I have a call in to Portia, but with my little expedition the last few weeks, we haven't been able to completely connect. I promise to follow back with you just to make sure that you know specifically how much has been used in the non-entitlement areas, and to give you just an idea of that going forward. So I apologize for not having that in advance, but our communications just didn't get connected. So with that, open to any questions that you might have.
Commissioner Malone?
Yeah, Rick, so this all will work swimmingly if we extend the deadline to April 1st of this year?
That's correct. Yeah, it would give us the ability to use the money all the way through that period of time.
That's only 2 months from now.
That's correct. And so part of this was that we got sort of the tentative agreement early on from Business Oregon that they would allow this, that was all acceptable, but we've been sort of holding off on any of the final commitments until, of course, the board acts. So what I would say to you, Commissioner, is that through community lending, they have been working this program to have expanded parameters, but haven't made the final commitments until we have this signed agreement.
Okay, thank you.
All right, thank you, Rick. Any other comments or questions or a motion?
I'm ready to move to approve amending the current IGA with Business Oregon for a $150,000 small business and micro enterprise grant to extend the use to April 1, 2022 and expand the eligible use to all areas in Benton County.
Second. All those in favor say aye. Aye.
Aye.
Motion carries. Thank you, Rick.
Thank you, commissioners.
Good afternoon.
Go spend some money.
All right, that brings us to our next item, which is other. And I would like to just briefly talk about the Board of Commissioners supporting House Bill 4123. And Pat, I did send an email a couple days ago and I just resent it. So it'll be right at the top of your email box. If it's lost under a bunch of emails, as often happens to me. So this is the bill that's going to the legislature to ask them for the $8 million for $1 million each for 8 pilot projects for the homelessness stuff. So some background, Councilor Gabe Shepard with the City of Corvallis, who's also on the Legislative Committee, reached out to me on Friday, and the City of Corvallis is basically asking us to do a joint letter, sign on to a joint letter, saying that we support it. City staff had a chance to vet the letter and make changes. So I guess I'm looking for 2 things, kind of just a broad support that yes, we support this bill in general as it directly benefits us, as we've been chosen as one of the pilot project cities or city-county partnerships. And then also giving the approval to sign on to any letters of support to go to the hearings to support it. So this is one of them. I attended, all these meetings have so many long names. I attended another meeting last week hosted by AOC and LOC, and they had mentioned that they will probably make one letter and then have all of the jurisdictions sign on to that as well. So just looking for some support from the board saying that we can sign on to whatever letters need to be submitted and that we support it in general. Comments or questions, Commissioner Malone? Do you need another minute to look over the attachment?
I looked it over this morning, the information that you sent Sunday, and I've been following this Benton, Deschutes County, as I saw their letters. I'm really glad that Benton County and Corvallis are included in the pilot program funding. So I would be glad to make a motion having Benton County support House Bill 4123 and sign on to a letter of support, which would include the LOC, AOC kind of letter.
Perfect. And how about the letter in with the City of Corvallis? Would you include that in your motion, friendly amendment?
Absolutely.
Perfect. Second, all those in favor say aye. Aye.
Aye.
All right, motion carries. Thank you very much. Next, I just had a quick question. The National Association of Counties conference that is in Washington, D.C. in a couple weeks. Are you going to that, Pat?
I looked at it and just with our wandering staff having COVID troubles and just keeping track or listening to April Holland, I think I will not be doing much traveling in February, and hopefully, which would include the NACO DC conference. So no, I'm interested, and we'll try to see what I can glean online, but I will not be getting in on the airplane at least this month.
All right, thank you. And we'll have to find out from Commissioner Ojro another time. I am not going to go. Oh, sorry, go ahead.
I talked to her a couple of weeks ago because I know she's gone in the past, and she is not planning on attending.
Okay. Well, I am also not planning on attending as much as I would love to go to Washington, D.C. Like you said, Pat, just COVID and, fears of getting stuck there And also, frankly, my husband already claimed the weekend for a guy's trip. So it's good for him. He needs it.
Well, and plus, just the report from Nick, we have plenty to do at home.
Yep. All right. Well, thank you. Do we have anything else to include under other? All right. So now I would like to take a 10-minute break, and we will prepare for our executive session. So let's come back at 10:16 and we'll double check that everything is ready to go at that time for the executive session. Thank you.